Welcome back to Interview with the Experts, a podcast series from Mayo Clinic Cardiovascular Education. I'm your host, Dr. Luke Burchill. I'm leading the heart failure care pathway here at Mayo Clinic. And today I have a very special guest joining me, Kelly Pasalakwa, our social worker with the Adult Congenital Heart Disease team. Welcome, Kelly.
Well, thank you very much for that. I appreciate that. It's good to be here.
Great to have you here. And I joined the team just over a year ago now, and I've been learning a lot about what is a licensed clinical social worker. So for those that are listening, and I think our audience is going to include cardiologists, other physicians, maybe even patients, can you explain what is a licensed clinical social worker?
Well, social work, it's been such a great adventure in my, 30 years now of being a social work, and I've seen many different changes over the years. Coming to Mayo Clinic, I've been able to be on the inpatient side of things briefly and have spent most of my time in the outpatient area. And so there's definitely a variety of the social work role. And, many are very familiar with our inpatient types of approaches to care, which involve a lot of, discharge planning and crisis intervention and those types of things. And I think over the years, we've really expanded out to the clinical areas, particularly specialty clinic areas, and congenital heart disease being one of them. And it has been very great to be able to get a little bit more in depth with our patients and get to know them a little bit more, and provide a really kind of health and well-being type of support and really assessment for them, which includes, going through and getting a bit of a social history and going through and then doing assessing for some of those psychosocial circumstances that may arise.
Yeah, look, I've had such positive feedback from the many patients that we have seen. Often, they will have seen myself and yourself in that same visit to Mayo Clinic. And the feedback, not just from the patients, but from the families, has been extremely positive. I think that we have less time for our very complex patients to really understand that social history. So I was going to ask you, perhaps this is the patient that's listening out there, they're wondering, what does social history actually mean? What sort of things are you delving into with patients and families when you explore social history through your lens as a social worker?
Yes, it's a great question. I think it really, for me to get a good understanding of what a patient's about, where are they from, what are they doing in their life, it really speaks to kind of the trajectory, I think, in caveats that might come up for them from the medical side of things. So it's really good for us to know who are their supports. How do they cope? What does that look like? And really, what are their available resources? So are they connected to any services or programs? Are they a person who has a lot of supports, or is it a person who has very minimal supports? And yet people who have minimal supports can function very well. We just use their supports, right? Particularly in those hard times. Or I don't even want to see hard times, but in those more stressful times, if there is a need for a procedure or some type of intervention.
For sure. Okay. And that's a really, really important point. Sometimes there's some more urgent or pressing needs because of an intervention or a major event. And at other times, it's really just that ongoing, more or less, I don't know if this is the right term, but it's sort of maintenance. How do we keep people on track?
Maintenance is a great word. And I actually even provide people with kind of a maintenance mental health tool after we're done kind of speaking, particularly if they've gone through an intervention and they've done well. I give them a mental health wellness plan just to kind of keep up with what they've been doing, which is really helpful for them. But I think what's wonderful too is when patients, if they're coming and they don't necessarily need anything right away, we can get some of this sort of out of the way, right? Let me collect some of this history. What do you do for work? What are your insurances? Some of those basic kinds of things. What does your family unit look like? Who lives in the home? Those types of things. So we have some of that sort of every year we get to review it, check in, and then also really do have some nice solid discussions surrounding their mental health well-being. And that could be, a talk about their stressors. It could be a more in-depth talk about how we want to know more about how they're coping as well. So they're coping, like what sort of drives you to feel better at the end of your day, or when you are in a bit of a crisis, what's typically helpful. And also just looking at sometimes more in-depth discussions surrounding anxiety and depression, which is prevalent for about 30% of our patients. And so I think just being able to normalize those discussions, and I think our providers in our group are really great at just normalizing this holistic approach to care. So I feel very privileged to work with this group because they're really looking at that entire patient in a holistic way, which is, I think, the beauty of why I've come here about 4 years ago as the first social worker to be able to do this with our congenital heart team. So it's definitely a privilege from that standpoint as well. So.
Yes, and I know that the team sees your role as being essential for the care we provide. I think the team in general believes that to provide whole heart care, you've got to provide whole person care.
Mm-hmm.
One of the challenges is that often we have a lot of heart history, a lot of interventions to understand, a lot of anatomy to review. And we're interested in people's social environment, community environment, and mental health, but we're only really able to touch the surface. Yeah. So having you available with your expertise to take that deep dive is really a great compliment to the care we provide, with that goal of providing whole of person care. So a big thank you for you for everything that you do for our patients.
Thank you.
So I wanted to ask you about another term that people might be hearing about, social determinants of health. Can you break that down?
Yeah, that's a great lead. So social determinants is basically the conditions in our environment. So how do we kind of live, work, play, interact with people, worship, our social functions, those types of things. And many times those social determinants can impact our quality of life. So that's why it becomes really important. And I really am impressed with the American Heart Association actually put together a social determinants for health, specifically for congenital heart disease. And they talk about the financial impact and employment impact, the social environments, what are the available supports. They talk about even just how can we get all the way to a congenital heart center when I live 500 miles away to the nearest center, and it's going to cost me money, and how can we afford this? And so all of these things are this is a good example of a social determinant that affects an individual with congenital heart disease. Other factors for our congenital heart patients are just that ability for employment, and if they're functioning well or if they're not functioning well, we know that there's going to be time off of work. And that impacts the family support, right? So they might be the person who brings home the money, or having to maybe be on disability for a time, and how that might impact the family. So there's just all those types of things are very impactful for our patients in general. And I think impressive for us to take note of as we continue to work on their biological needs, their psychological, and their psychosocial needs.
So true. And, I recently saw a patient who had very complex congenital heart disease, and we observed a significant improvement in a number of her test results. And there was a thought process around which medication might have achieved this. And in fact, it was a change in her social circumstances and a shift from being in an environment and in a home situation that was really not healthy and incredibly stressful to one that was healthy and supportive. And for me, it really sort of drove home that point that, again, we're not just looking after people's hearts, we're looking after people in a body, in an environment, in a community. We have to pay attention to all of that. So I thought, just again on that thread, what are examples of some of the practical interventions that you've implemented for patients that you see in the adult congenital heart clinic. Can you provide some examples?
Sure can. So it is true that many of our patients do struggle with stressors, and whether they are more kind of external of the social determinants or they're more impactful from psychological, we definitely want to help patients. So again, it's about getting in and getting an assessment, understanding exactly where the patient's coming from, and then actually acknowledging what can we do about some of these issues. Are some of these stressors, are they fixable? Are they not fixable? Then how do we sort of navigate to a coping structure instead of a just stress structure? Okay. And that's a good part of where a lot of the anxiety and depression is coming in for a lot of our patients. And so trying to get a good understanding of the impact of their depression or anxiety or stress, it just could be stress. We really want to help them navigate towards more coping mechanisms versus staying in the, I always say, staying in the weeds a bit with it. So just being able to talk to them about anxiety reduction. So it could be doing some diaphragmatic breathing, something called progressive muscle relaxation, and something else called guided imagery. And all of those three have been very helpful in lessening anxiety in a patient, particularly who is struggling. And those are something I get to teach. So we get to do some practice deep breath work in the room, and that's very fun. And going through just these exercises. And 9 times out of 10, people are saying, this has been really helpful and has reduced my stress level just by being able to do it. Another fundamental positive way to kind of work on some of these stressors and thought process is to actually use our mind to restructure how we're thinking about something. So it could be that it's been a very long winter for many of us, right? So everybody has been stressed about this. So the trigger might be the weather has been terrible. And how we would turn that trigger from a distress concern, which many of us were like, oh, this has been way too hard this season. It's going to be, summer is coming. It's on its way. The trees are bloomed, right? So that's just how do we sort of move that thought from a negative thought to a positive thought. So doing cognitive restructuring, that's the formal.
I think that we could all use this, not just our patients.
Yes, right. I think we all needed it for this winter.
Do you find that sometimes your colleagues are as interested as your patients in some of these practical things that they can do to help reduce stress and do the cognitive restructuring?
Yeah, I think that many people say, Kelly, can we talk? Maybe we should talk about that sometime for ourselves. And I agree, like we all could benefit from it. And sometimes it's just a good check-in, right? Just a good talk sometimes with a colleague, or how do we sort of look at this differently? And I think we informally do it quite a bit. I don't think people give themselves as much credit for informally discussing the hardships sometimes, but we do it quite frequently. But yeah, I'm available anytime for patients or staff.
Well, look, I've learned a great deal from you. It's really expanded my understanding of the role of a social worker. I can hear it's beyond the things that I learned many years ago, was particularly focused on supports in the community, maybe financial community supports and agencies. And now it's this expanded role that includes mental health diagnosis and treatment, really practical supports that can be offered almost in real time to our patients. I really like some of these things like the progressive muscle relaxation, the reframing, the cognitive restructuring, and probably most importantly, I'm hearing from our patients the positive impact that it's having. So thank you so much for your time today. Was there anything else that you wanted to say about social work, the role of social work in this space?
Thank you for having me. And we have a great team here at Mayo.
Pleasure. Thank you.